think you had a question for Senator Harris and President Obama about the pandemic.
Yeah. So, we're 7 months into the pandemic, and too many people have lost their jobs, their lives. And yet I hear Republicans, they want to end Obamacare. And yes, it is a little weird saying Obamacare. I'm looking at President Obama right now, but it's okay. It's all good. But there's a lot going on, seriously, especially for Black and brown people. So, for me, it's hard to sleep at night, but like, what keeps you up at night, and how do we fight back, once you do get in office?
Senator Harris, you want to take it first?
Sure. So let's just think about, what's happening, obviously, right now. We know that I think there are over 205,000 Americans who have lost their lives, and over 7 million people have contracted the virus. And as the president talked about quite extensively, President Obama, we have the Affordable Care Act that was the creation of his administration together with Vice President Joe Biden. It was probably one of the most significant public policy initiatives that any presidential administration has been able to accomplish in generations. It brought health care to over 20 million people who did not have it. I cannot stress enough the significance of what it did in terms of extending protections to people with pre-existing conditions. Why is that important? Well, look at how COVID has now accelerated the disparities based on race and economic status in America. The evidence of that being that African Americans and Latinos are 3 times as likely to contract the virus, twice as likely to die from it. And a large part of those numbers have to do with the longstanding pre-existing conditions based on race that have existed in America, such as diabetes, high blood pressure, lupus, cancer, things of that nature. Well, what Barack Obama and Joe Biden accomplished with the Affordable Care Act was to say people who have those pre-existing conditions should not be barred from having coverage when, of course, they need it so much. They need access to health care that is affordable. And it seems like it could never have been that way. But before they passed the ACA, the Affordable Care Act, Obamacare, people with pre-existing conditions were being denied coverage, And right now, the current administration is in court, again, trying to get rid of the Affordable Care Act and go back to those awful days when people who had these diseases or had these pre-existing conditions would not have coverage. And think about it also in the context of COVID, in terms of the fact that 7 million people now have contracted this disease and thank God have lived. That's going to be a pre-existing condition. That's going to be the potential for lung scarring, the potential for heart damage. And so what is at stake in this election is the protection of that most important public health policy, which was the Affordable Care Act, also known as Obamacare. The other thing that we have to understand about this issue is that we're talking about racial disparities based on gender and race. So, for example, Black women, I spoke about lupus earlier, are 3 times as likely to suffer from lupus, which is an autoimmune disease. Michael, you and I both have women we love deeply in our life who have lupus. And when we look at the need for constant medical attention and treatment as it relates to that and affordable medication, that's a very big deal. The Affordable Care Act also did something that is critically important right now when we have so many people who have lost their jobs or are graduating high school and college and may not have job prospects right now, which is this. The Affordable Care Act said a young person up to the age of 26 can be on their parents' coverage. If that lawsuit that they've got in the Supreme Court to get rid of the Affordable Care Act is successful, that will no longer be the case. So there is so much at stake. Joe Biden and we have laid out a plan that would not only be about keeping the Affordable Care Act intact, but also building on its success in terms of extending its protections. And the protection would include what we need to do around prescription medications and making them more affordable, and expanding access in terms of opening the exchanges and things of that nature, so that all people will have access to health care, and that we will be motivated with the understanding that access to health care should be a right and not just a privilege of those who can afford it.
Mr. President.
Well, look, Kamala summarized it well. So here's one way to think about it, Michael. You got people who are getting health insurance because of the Affordable Care Act, right? Because either they're getting subsidies to buy insurance, or they've gotten Medicaid expanded in their state. That's the reason why they have health insurance. Mm-hmm. And if that's taken away, then right away you got people who just lose health insurance altogether. But you have also millions of people who have better insurance, better protections under the insurance they have already got because of the Affordable Care Act. Because it basically says to insurance companies, you've got to cover people in a certain way. You can't discriminate against people in certain ways. You've got to provide preventive care, et cetera. So if you don't have health insurance and you've gotten it through the Affordable Care Act, obviously you don't want to lose your actual coverage. But even if you don't depend on the Affordable Care Act to get coverage, you are dependent on the Affordable Care Act to make sure that the coverage you have does what it's supposed to do and treats you properly. And there's two other things that I want to emphasize. Number one, the Affordable Care Act itself was always sort of a starter home. It got the ball rolling towards universal coverage, but we have more work to do. And Joe Biden and Kamala Harris have a plan to expand and make even more accessible coverage, essentially to put some additions on that home. And, as the family grows, you get that first little bungalow, then you gotta kind of build out. And there were gaps in coverage under the Affordable Care Act, not because I wanted the gaps, because that was what we could get done at the time. If we all vote, then we've got an opportunity to fill those gaps, which means it's not just the 20 million people who are already getting coverage through the Affordable Care Act. There are millions of more people who still need coverage. Those are people that we need to reach. And the last point I would make, there is a public health infrastructure that we rely on in order to deal with public health threats like COVID. That public health infrastructure relies on having competent people. It relies on clear leadership from the top that we're going to follow the science. It requires, honest, effective communications to the public about here's what we need to do in order to make sure that we get past this disease. And the fact of the matter is that I am confident that Joe Biden and Kamala Harris will preside over an administration that says, here's what we know about wearing masks, and this is why this can prevent this disease. Here's what we know about the racial disparities, and here's what we can do to reduce those racial disparities. Here's what we know with respect to how schools can safely reopen, not just randomly reopen. Here's what we know. We want to make sure that businesses can operate, but we're going to send a clear signal about how a business operates effectively in this environment. This is stuff, by the way, that other countries have already been doing, which is the reason why our rates of death and infection have been significantly higher than countries that are of our same economic status. And for those of you who may not think that you're going to be affected directly because you've been following all the protocols and or you're young and healthy and you figure even if I get it, I'm okay. understand that we're not going to heal the economy either until we solve the healthcare issues at stake. You know, we can say all we want, yeah, go ahead and open restaurants. But the fact of the matter is that people aren't going to go to restaurants. I hate to say this, Michael, but they're not going to go to movie theaters. They're not going to do a whole bunch of stuff until they have some confidence that they're not rolling the dice with their health or their family's health. You think about all the parents right now who are trying to figure out, how am I supposed to be doing at-home learning with my small child, but I've also got a job that I've got to get to. And I'm not in some, white collar profession where I've got flexibility. I've got to punch a clock, but I also got a 5-year-old at home.
Yep.
Now, the economy is not going to heal, and those families are not going to be made whole, even if they're not sick themselves, until we solve this public health problem. That's on the ballot. One more reason to vote.
Thanks.